This patient we are going to replace the right lower molars. This supraerupted and mesially migrated 7 and 8 we are going to remove and place 3 implants. Since it is a healed area, we are going to place compressive implants. We will see the immediate post-op. So we have placed 3 implants, all compressive rough surface, 4 into 10, mostly 10, we will check. It is around 12, 4 into 12. This is also 4 into 12. You can see the nerve is safe. The last implant is a 3.5 implant placed close to the lingual plate, but not any engagement. This will be the nerve.